Hey guys, welcome to Recovery Lab. We just wrapped our interview with Dr. Mark Hrymoc.
Mm-hmm.
And it was about, a lot of it was about therapy, but we also talked about ketamine. And that's something that I just have some thoughts on.
Mm-hmm.
I'm glad that we got to interview Dr. Hrymoc. What do you think about it, David? How
Well,
was that experience for you?
I mean, I've abused. I'm a multi-substance abuser. I mean, I used a
Mm-hmm.
lot of stuff growing up. I abused everything from Benadryl to ketamine to weed, whatever. And so it was definitely difficult for me to listen to. Is this is something that I've abused,
Yeah.
and to hear that it could be used in any kind of therapy, it's kind of just like I got the cotton in my ears at this point because
Mm-hmm.
I don't want to mess with my sobriety is the most precious thing in my life, and something that's going to knock that off. I don't care what it is. I don't want to. I don't really want to. And for me, not what I want to do. I want to be real careful. Am I spreading that around? I think that's why we want to have this conversation that you and I are having right now about like, is this something that we got to really let people know our
Yeah.
stance on this before we just put this out to the masses of like, hey, this is something you might need to investigate or talk about because it could have some dire consequences if for a lot of people.
100%.
Yeah.
If I if I'm not working my program, if I'm not going to meetings, if I'm not working with other alcoholics, then that feeling of like wanting to change the way I feel
Mm-hmm.
and just that uncomfortability, that's going to sneak back in. And when I hear of something that is going to change my life and make me better, and also it feels like laughing gas, like
Right.
that that could very quickly, if I'm not in a good place, that could sound like a good idea to me. And all of a sudden, my kids, who I'm loving being a mom to, my
Mm-hmm.
husband, who I adore, all these things, all these blessings that I've gotten from this program are very quickly up for grabs
Mm-hmm.
because I'm honestly considering throwing all of that away for a trip. Because in my mind, it's going to be, oh, well, it'll just be this one time to get this healing for so and so, but I can 100% see myself having that experience. And I mean, I have it at the dentist. You know what I mean? And when I get like the
Mm-hmm.
laughing, when I leave there, I'm like, God, that was fun. I wish I could do that
No,
more often,
I'm
you
looking
know?
forward to my next colonoscopy. Come on, doc. You know, no, I get it. I get it. I just we want to just put that out there. People who are listening, at Recovery Lab, we want to talk about a lot of different things that are going to help people find a lifestyle, a recovery lifestyle that gets them out of the throes of addiction. For us, that's been the 12-step stuff. That's been a lot of therapy, a lot of hanging out with friends, a lot of church. And it has not been a lot of any of this other stuff that's coming to light. We do want to have those people on so we can kind of get their side of what they're seeing in the treatment world. But at the same time, we want big, bold disclaimers out there that be very, very careful. We're not condoning, we're not endorsing, we're not saying that you should do this. We're just talking to people about what things are happening. But we do not want people running around saying, you know what, meetings aren't working for me. I'm gonna go dose this stuff. I'm gonna go do these things.
Yeah. Yeah. When I hear that, it makes, I don't know. I don't know. I don't know. This whole thing is tricky for us.
Mm-hmm.
And I do credit Dr. Rymock for coming on here and answering or trying to answer these questions that we have. And so, you know, the fact that I don't, like, I'll just say I don't think ketamine is a good idea for people struggling with substance use.
Mm-hmm.
That's just, I'm just going to say it, and that's how I feel about it. That's just coming from someone who I know it would completely throw me off course.
Mm-hmm.
Um, that being said, I'm grateful that he came on here and talked about it as a medical professional.
Mm-hmm.
Um, but I don't like it.
Mm-hmm. You know what? We're just glad that y'all are listening. And hopefully, if you do have strong feelings about this, or if you want to come on and talk about what your side of the story is or what you think about it, we'd love to have you come in the studio and be a guest on our show and talk to us about what your thoughts are on different modalities of recovery, or if you've had any experience doing any of what we've been talking about the past hour or what we're about to talk about the next hour. Please, reach out to us on Facebook. Call Daniel Anderson at Audio Alchemy. And we'd love to have you on and talk about that. That's what we're here for, is to have a
Yeah.
conversation about recovery, why it's important, how it works, and how to get it. That's what we want to do. So.
100%. And I think now more than ever, the tone is that we should be able to have open dialogue with people that we don't necessarily agree with, no matter what the topic is, you know? And so it's safe to be able to do that and not come away just hating each other. So all respect to Dr. Hrymoc. And you guys, please like, subscribe, share our episodes. It really does make a big difference. I didn't know that until I started doing the podcast with these guys. And so now I start doing it with podcasts that I enjoy, because it really does make a big difference. So every like, every subscribe, all of that, we really, truly appreciate it. All right, you guys enjoy it.
This is the Recovery Lab.
Here we dive deep into the struggles, victories, and hope that stem from recovery.
No shame, no judgment, just truth, grace, and inspiration.
Let's walk this road together.
Man, that intro never gets old, man. I love watching that video, and you're getting better at it. It's still fun to watch. Welcome back to Recovery Lab. I'm David Sugg.
I'm Brynn Knox.
I'm Daniel Anderson.
And we are the Recovery Lab. And we are here this week with a psychiatrist dealing with helping people with addiction. I'm super excited to interview you, Mark Hrymoc. Say hello to us, Mark. Dr. Mark.
Hi, everyone. Thanks so much for having me.
Yeah. So it's taken us a little while to get you on the podcast. We're super excited to hear what you have to say today about how you're helping people deal with addiction, how you're helping people deal with maybe some dual diagnosis stuff, just mental health in general. But just before I put words in your mouth, tell us, what do you do for people suffering from addiction? What is your specialty?
I'm a board certified psychiatrist and addiction psychiatrist specifically, which means I did more studying in treating addiction, and have been working for 18 years, have worked in rehabs, mainly work in my private practice where I help people with detox on an outpatient basis, anti-craving medications, and also treating primary psychiatric issues, often depression, anxiety, insomnia, that might predispose a person to addiction or relapse.
Yeah, I guess it's pretty common that when you see somebody suffering from addiction, there's always something else going on. It's never just, I can't stop drinking, partying, I want to stay out late. There's something. I know for me, it was, some trauma as a kid, divorce, separation stuff. So there's always a story that's fueling this stuff. So I guess you're not just going in there and saying, hey, quit drinking, come meet with me once a week, but really more like what's going on underlying, what's happening.
That's right. Yeah. The simple advice, quit drinking, would only work if a person had never heard it before or thought it before, which usually means that they've already heard it and they just haven't followed through with it. So that's what I help with. Yeah.
So tell me what you're most excited about right now in your field.
Continued work in addiction treatment. There's been destigmatization of addiction with each decade, so I am excited about that. In terms of your intro video, I also liked it too because it talked about getting rid of the shame and guilt that often keep people from seeking treatment and keep families even from reaching out for help for themselves too and their loved ones. So I'd say destigmatization continuing is the main thing I'm continue to be excited about.
Yeah, really cool. So I know whenever we'd booked this initially, you're doing a lot of different stuff. It's not just I guess cognitive behavioral stuff or addiction stuff, but you're doing a lot of multimodality. Tell us about some of the different things you're working on in your practice.
Sure. One of the things that takes up a lot of my time is developing a ketamine therapy program within our practice. I think in general, there's some controversy in using controlled medications to treat anyone with addiction issues. Same could be said for treating ADHD with stimulants in someone who may have had a substance issue, or even treating things like anxiety or sleep issues with medications like benzodiazepines. I think decisions like that have to be taken really seriously with a lot of respect for the person's substance use disorder. One of the first rules in medicine is do no harm. So a person does need to be evaluated thoroughly to make sure that they could be a candidate for a certain type of treatment. But if they've tried conventional treatments and they've not worked with close supervision and monitoring, people may be candidates for treatments like that.
Okay.
What does that look like? If so, say you said nothing else worked, like what?
For treating depression, let's say, that tends to be the most common mood issue. People often, by the time they get to me, will have tried a few different antidepressants, often 10 or more. So medication treatment having failed, and also various types of therapy, which could include a few stints of residential treatment, a few stints of outpatient therapy, meeting with a therapist once a week. And yet people might still be struggling with mood issues and substance issues. And those two issues can also feed off each other and destabilize each other too.
But what are they doing for their substance issues that aren't working besides therapy?
A lot of people have tried 12-step meetings and for one reason or another don't gel with it. They don't bond to it. They say they've tried it, and that could be looked at and debated too. But their belief is that, let's say they've tried 12-step and that doesn't resonate with them. It's not something that they have found a solution in. And likewise, they may have tried other types of treatment too, and yet they continue to struggle.
Do you have any lived experience with addiction, or you're just one of those crazy people that decided to work with us?
I have lived experience as a family member of people with addiction issues. My family's Eastern European, Polish specifically. So vodka at times has seemed like the national drink, especially when I was growing up. So, I have a really close-knit family. So a lot of uncles, aunts, cousins that have certainly had alcohol issues. There have been some opioid issues in my family. Thankfully, I've not had a specific substance issue, and no one in my immediate household has, but I've definitely seen the fallout that it can cause in families of my cousins and things like that.
Is that what made you want to get into this, or you just found it more interesting than other things?
Yeah, I'd say that sparked my interest. To be frank, my mother actually was a physician, but she was a smoker when I was growing up. That's actually one member of my immediate household that had issues. And in general, I was just fairly interested in people and the reasons they did the things they did, why they made the decisions that they did. And, got to studying psychology in college, really liked that. I worked at a drug treatment research center in college, which to me introduced the concept of actually using medications to treat addictions. And I continued that interest through med school and residency in psychiatry, and brought me to where I am today.
When you were growing up and you saw like the fallout in your extended family from like the decisions that these people were making because of vodka or because of whatever they were struggling with, did you look at those situations and be like dude, stop, you know what I mean? And then like, if you felt that way, like, why can't they just stop? When did you realize like, oh, maybe they can't stop on their own? And what was that like?
Yeah. Yes, everyone would tell people to stop, let's say. And I remember even like as a kid, my mom would say smoking a cigarette outside and me coming by behind her with scissors and like cutting it in half, and she would stop. If that doesn't send a message to a person. So yeah, it's not the lack of messaging that is not is missing in treating, even family members or intervening on family members. Like they've gotten the messaging from various family members. So simple advice giving, as much as family members have a fantasy of it working, is really not enough. They do need to actually work with a mental health professional, I would say, to look at, the reasons and even assess their motivation. Where are they at? And, we might not be able to make them determined to quit today or tomorrow, but if we even just move someone one step further towards the premise of like, maybe my life would be better without this substance, then that is a success.
Yeah. I know when I was in the throes of addiction, it took me a long, long time to just kind of even get prepped to get prepped. I mean, like I went through counseling and therapy and treatment centers and then jails and then prison. And I mean, I had to hear it a whole lot before I could even get to a spot of, I don't know, how does the book describe it? A state of reasonableness. I mean, I had to get beat down just and get a lot of information. And before I could really even understand what was going on, because for a long time, I was just convinced that there were just too many damn rules. Like if y'all would stop making rules and stop patrolling my street and give me enough money, then there would be no problem. Everything would be fine. And the thing is there were times when I got that, the cops didn't come around. I had plenty of money and I was still miserable because the addiction was still just kicking my tail. And then the worst of it is when the drugs and alcohol stop working and you're just all left with that loneliness, that despair. I mean, it's just now I'm not even drinking to catch a buzz. I'm drinking so maybe I don't wake up. Maybe it'll just take me out. And that's when I was ready. That's when I was really, really ready. Let's do something different. As honest and as desperate as a dying person could be, I was like, all right, let's do this. And thankfully for me, I've been able to get sober, be continuously sober now for almost 16 years by the grace of God and 12-step meetings and people like y'all in places like this. But I've done it pretty much strictly through the 12-step model, get a sponsor. I blew his phone up for the first 3 years. I'm going to like, they say go to 90 and 90. I went to 3 meetings a day, and I was working a full-time job. When I wasn't working, I was in a meeting. When I wasn't working or in a meeting, I was working with somebody. I mean, I was just doing the deal. And no therapy, not because I didn't want it, because I didn't have health insurance. It wasn't going to happen. And I just kind of did it. So now fast forward 15, 16 years, and I start to see a lot of different stuff coming to light, like what you're talking about, kind of medically assisted treatment, whether it's going to be in the Suboxone realm and naloxone, or what we might talk about later on ketamine. And honestly, it kind of ruffles my feathers in a way because like I've done the work. I've done a lot of work unmedically assisted. Like I had parole assistance, I had law enforcement assistance, I had IRS assistance, but I didn't have any medical assistance. And some people were like, well, this thing really works. Part of it, it might just be my ego. It might be my protectionist kind of outlook on what I think of as a 12-step program. I really want to kind of just save that and set it aside for people who are really serious about it. I don't want to adulterate it with, and also I get kind of freaked out when people are in meetings like nodding off from Suboxone. It's like, what are we doing here? So I got to say, I'm super excited to talk to you because I see this is the trend. This is where we're going, and science is doing things that it's never been able to do before. But at the same time, my butt kind of puckers a little bit because I'm like, man, I don't know if I want to hear this stuff because I want everybody to have what I've got, and what I've got is just like nitty gritty 12-step in the trenches, working with drunk sobriety. So I'm coming into your office right now. And I'm telling you that I've been sober for a little while, or I've tried to get sober. It's not really happening. Sell me on your practice. Sell me on that instead of just spinning me around and saying, here's a meeting sheet. Go to 180 meetings in the next month, find a great sponsor, and do what David did. Sell me on that.
Yeah. I first just acknowledge that they've tried 12-step, and 12-step works for many people. And I love 12-step. And for people that can bond to it when they're ready, might also be another thing. It can help like no other treatment, right? But now that you're telling me 12-step, hasn't worked for you, you feel like you gave it the college try that you should, then, we need to do some type of psychosocial treatment something that gets you thinking and talking about things. So if not in the rooms of 12-step meetings, then, what could work for you? Is it group therapy led by a therapist? Is it individual therapy, like maybe just one-on-one? That's usually the thing that gets people the most engaged, because it is kind of a one-on-one setting. The attention's on them. They're actively participating in it. Maybe even when they've tried 12-step, they've been in the back of the room and not fully participated, but they'll still think that they did. So very often it's some part of like psychosocial treatment, something that gets a person thinking and talking about the reasons that they use, the depression or other mental health issues that they have, and how they've treated that. And then also looking at, do you have a mental health condition that could benefit from a certain medication treatment too? So, very often people will have some amount of depression or insomnia that they are self-medicating. I definitely see people with addiction issues as being like amateur psychopharmacologists without any degree, and they are just, medicating themselves most of the time for either trauma, depression, insomnia. So, let's look at those things, because substances that are out there that people commonly use, alcohol, opioids, nicotine, they don't make for great medications, and that's the reason we call them drugs. They're self-administered. They're not evaluated by a professional, because honestly, if a professional was going to look at those medications, like alcohol, for example, being still the most common one, it's very short acting. It's very potent. The difference between a quote effective dose and a problematic dose and even overdose is very small. So dosing is really hard, and it's metabolized by the body in an hour. So, no one's going to be able to accomplish the balancing act, though many try for a long time unsuccessfully.
Yeah, I stayed drunk all day, so that was my trick.
Yeah.
Like,
so,
this is not working at 11.
Yeah. So there are better medications than alcohol that are out there, right? And so, let's talk about those. So could be like SSRIs, also known as antidepressants, that just in general reduce the amount of depression and anxiety in a person's emotional climate, make a person less predisposed to having their mood issues become a problem in and of themselves, right? Life throws everyone curveballs. There'll be stresses. I also want to know about stresses in a person's life and what they're dealing with. But stresses, if anything, should kind of be like indicator lights on a car dashboard, like a little beeping here or a light here, but it doesn't necessarily derail a person's travel down the road. So, sadness, frustration, anger, negative emotions that we feel should actually inform you about your psychological environment and help you make decisions that will get you out of a bad situation and improve your life going forward. But when that depression or other mental health issue gets so bad that it starts becoming a problem, it even starts holding you back from being able to address the current stresses that have brought you to this place in the first place, then that's when we start calling it a disorder, something that is a medical issue that deserves an actual treatment.
So tell me, this ketamine back when I was getting messed up was like, okay, we're out of alcohol. We don't have any more Lortabs. All the crack is gone. We've got this thing that we stole from my vet. It's called ketamine, and we can it'll put us under. It's not going to be a lot of fun. In fact, it was called a K-hole.
Yeah, let's get the K-hole.
Yeah,
baby.
It was a dreadful. It was just like, the buzz of last resort. Like, let's just do it, man. You snort them, plug them, eat them, whatever. But it was not like, hey, I've got some ketamine. Why don't you guys come over? We're gonna have a good time.
Have a spiritual experience.
Yeah, but it was something that was available if we were, like up there with like Dramamine or Benadryl. Okay, we got some, whatever. But so tell me, how does it go from this, like, not really even I know some guys did abuse it, but it was, this kind of lesser street drug that wasn't used a whole lot, to now it's got some kind of a use when it's put in the hands of a practitioner who knows how to do whatever you're doing. How does it go? Like, who's the first doctor sitting around like, wow, man, this is really helpful. This is doing something besides just like putting a cat under.
Yeah. It was first discovered to be useful when people undergoing surgeries were receiving ketamine were reporting that their mood was better after the surgery. Their depression actually got better as a secondary result of whatever primary surgery that they were getting, and so then it was studied and determined to be an actual fast-acting and potent treatment for depression. Going back to your first,
how is it working as a different than just like the Wellbutrins, Prozac antidepressant? What's the difference here between, because it's not the same thing, I mean, it's not an SSRI, it's not like, what is it doing that those other things aren't doing?
Yeah, it works on glutamate. It is a glutamate blocker, glutamate being a stress hormone, a neurotransmitter that's in the body that when blocked can increase dopamine, also improves mood as a result of that, also stimulates BDNF, brain-derived neurotrophic factor, which I think of as your body's own healing and growth promoting factor for brain cells, so it makes brain cells thicker and more branchings between brain cells. If we think of depression as a condition where there's a depressed amount of activity in certain parts of the brain, ketamine helps restore that. And it does it quickly.
Stimulating some growth.
Yeah, stimulates neuron growth. Yeah.
Okay. So people are using this for surgery and they're coming out of it and they're saying, hey, I feel like, I guess they're doing a post-surgery or post-procedure kind of interview or whatever. Hey, how you feeling? What's going on with you? And people start reporting like, I actually feel a lot better. I never even noticed my spleen was removed. And they're like, oh, great. What's that about? So maybe it's this ketamine stuff. And so people like you start running some tests on it, start saying, all right, this is actually working for some depression stuff. And they start doing more and more research. And now you're using it in a clinical setting that's not to put you under, that's not for a surgery thing, but it's actually as a basis for some sort of therapy. Now tell me what that experience looks like, what's going on there, and how is that different from me eating it in my closet to using it for surgery to you actually doing something in like a very, very different dosing, but also while you're taking this stuff, you're doing things. It's not just here, take this and report back to me. Tell me about what someone like you does with ketamine.
Yeah, the vital difference is the context. There's a difference between a medication and a drug, right? So you describe people using it as a drug in the recreational setting for recreational reasons, not specifically trying to address any even mood issue, and they're also prescribing it to themselves in conditions that are potentially dangerous. You mentioned like when the alcohol runs out, so there's already alcohol in the system and that sort of thing, as opposed to like a medical context. There's a full good faith psychiatric evaluation, which is a 1-hour visit where we talk about the current issues as well as like past history, looking at past attempts at treatment too, because it's not just given willy-nilly to anyone who says, oh, I'm depressed. It is a powerful tool, and one of my mantras is a powerful tool is capable of a lot of good, but it's also capable of a lot of bad. So the way we wield that tool is vital, and we have to have like a healthy respect for it.
Well, can I interrupt you there and say, how do you know it's not being given out willy-nilly? Like maybe you're not, but is every medical professional operating at that standard of not just giving it out?
Sure. Yeah. I would like to think that they aren't, but there are bad actors out there for sure. So yeah, I mean, there are, pill mills, right? Places where people can see, professionals who are still licensed and, just don't have screening criteria, ultimately trade dollars for, a prescription. Like one term is like gas and go ketamine clinics, where it's almost like a person is like a gas tank, leaving a credit card on the table kind of thing. So yeah, I mean, definitely there are people that are not respecting it, using it unethically, using it for ulterior motives, financial benefit as opposed to the patient's best interest.
I've seen it on the Secret Lives of Mormon Wives.
Tell me about that. I've never seen that show. I want to know.
Yeah, me neither.
Basically, they're just going into this clinic just for the trip. because they can't drink or anything like that because they're Mormon.
Oh.
They can't do anything. And so, but they're allowed to do ketamine for some reason. And so they go to this clinic and it shows them on the TV and they're like in there tripping. And the alcoholic addict in me is like, whoa, that looks fun. And doctors say this is good for people with addiction. So I don't know. It doesn't, is it like tripping? Have you done it?
I would say it's considered like a dissociative anesthetic with psychedelic properties. So
Okay, that sounds like a fantasy for people like me.
So yeah, it's not a classic hallucinogen. It's not like LSD or psilocybin mushrooms. It's actually a lot more like nitrous oxide or laughing gas that many people may have had in a dentist's office. So yeah, a person feels, sort of lighter, like they're maybe daydreaming. A lot of people describe it as like lucid dreaming. They may even forget that they're in a doctor's office. They may feel like just kind of like immersed in their thoughts, even think that they're like a million miles away for the time that the treatment is happening, which is, between the infusion, the IV actually drips for 40 minutes is the standard. And then it takes about an hour to kind of fully come out of the effects. It is a sub-anesthetic dose, so a person is not knocked out. They are breathing on their own. They don't require intubation or anything like that. They are conscious. If you tapped on their shoulder or spoke to them, then they would respond. They'd even be able to walk if they needed to. But for the treatment, they're lying down. In our clinic and most clinics, we have them wear eye shades to actually even get more into the experience, listening to music as well, because it works like biologically as a medication, but there is a belief that it works experientially. A person does go somewhere within their mind, people call it a journey, and can have like sort of a different perspective on their lives, maybe even like a quote, more objective way. They may not react as reflexively to pain or trauma. They may be able to work with things that have happened to them and the emotions, memories, feelings associated with it in a way that maybe they can't in their ordinary state of consciousness. And so this is where the concept of like ketamine assisted psychotherapy can be relevant to, where a therapist actually will sit with the person and sort of guide them through the experience, make relevant connections during the treatment, and even note what things a person says during their treatment to present it back to them afterwards, a few days or a week later, in what's called an integration session, where a person integrates the journey that they went on and in an attempt to make the most sense of it that they can implement as something positive in their lives and get better psychologically as well as biologically.
Okay, I have more questions.
Sure.
So I know that you know way more than like any of us do about, the human brain and the psychology of all these things. As far like going back to like the big book and the 12 steps of Alcoholics Anonymous, have you in your training and in your schooling and all that kind of stuff, did you ever have to go read through that book?
Yeah. Read through the book, went to meetings, done like internships in treatment centers. Yeah.
Nice. Okay. So when it's talking about like the phenomenon of craving and what we experience when we put something, mind altering into our body or whatever, how does an addict deal with that when they leave the clinic and they've just been on this, what sounds like a really good time? How do they deal with that as far as the phenomenon of craving goes? Because I could see myself leaving the clinic and be like, oh my God, I'm ready to get back. I want to go back. I want to go back. I want to go back. And it just really taken up all of my brain space.
Yeah. Yeah. I mean, first of all, I would say not everyone has a good time. Sometimes people, confront their demons, so to speak. They may have even, negative emotions elicited from the experience. The concept of like medication doesn't always taste good is relevant here too. Sometimes, yeah, they do have a quote good time. I think the context is really important. The person will differentiate, and in order even to meet to be in that clinic setting, in our clinic, they will need to have established like a good reason for being there, and we're trying to treat something here. We are not just trying to facilitate an escape from ordinary life. And these are questions that we check in on in every meeting with patients too, like were there any cravings or anything unsettling brought up by this experience. We'll only give the treatment to people who are in good and solid recovery as well. And I find that a very positive indicator for me is when someone that's in recovery actually, to me, expresses a worry or anxiety about, this treatment, and, will it make them crave or relapse? And to me, that means like they're already within them, like a self-protective vigilance about like anything destabilizing them. So these are the types of people that we'll give this treatment to. Yeah, one of my basic mantras is I never even want the perception that ketamine is a part of someone's cycle of abuse, and so that's to me like the criteria that I would use. And if I'm not sure, then I won't proceed down that route. There's a whole bunch of other routes. There's always other medications. There's TMS, transcranial magnetic stimulation. There's other types of treatments for depression besides ketamine.
I had a sponsee when I was living in Austin, and she we were trying to get through the steps, and she wasn't like in the best place, and someone told her about ketamine, and immediately she was like, she let me know, she's like, hey, I'm gonna go try this. And because she was just looking to like change the way she felt, and she got so completely addicted to it, and her life just went really downhill quick, and then she ended up back in treatment, and now she's back to working the steps, and has really improved her life so much. And so it scares me, this whole ketamine thing. It just scares me.
Yeah.
How many people have you done this with?
I mean, we started our clinic 6 years ago. So yeah, I'd say 2,000, 3,000 maybe.
And what are in the data? What are you seeing? I mean, how many people are coming in? I heard you mention that most of the people are looking to maybe enhance the recovery rather than begin the recovery journey. I think you said something about people that they've already got a kind of an understanding of some stuff. It's not just like, oh, pull them off the bar stool, slap them full of ketamine. It's more of they're kind of on the journey. So
yeah, to be clear, ketamine is not even recommended as a treatment for addiction. Like it's not within the standard clinical practice guidelines, which are basically the written published guidelines agreed upon by academics and researchers on like how addiction is treated. It is used as a treatment for depression specifically. So yeah, pulling someone off a bar stool, giving them the ketamine, there's an implication there that it'll treat their addiction, and that's not what we would use it for. Like we would only use it if someone has depression that's treatment resistant. So that is one of the criteria for ketamine as a treatment, is that a person has tried and failed at least 2 different standard antidepressant medications, and that's the criteria that we would use.
Okay, well, I didn't even realize that. I thought it was just
either.
kind of an addiction thing. I didn't realize that it was primarily for depression, as that is a commonly an underlying thing with addiction. It makes sense that we just kind of lump them all together, but it's not. From what you're saying, it's not the first thing. Oh, you got to get sober. Let's try this first. But it's you're getting sober, you're off the drugs, but you're still suffering from some serious depression. You're not making headway.
Correct.
Maybe you're relapsing, you're drinking, but it's normally what you're saying to deal with that thing, that depression thing. So come in here and try some of this. So of the 2,000 people that you've tried, you've mentioned that there's the experience is not necessarily the same for everyone. There's some people who might have maybe a giggle or two, maybe a good time, however we want to describe it. And some people come out maybe not having such a good time. Are you keeping track of, do you make a note of like how many people, how many treatments, what those experiences were like? Were they positive? Were they negative? Were they illuminating? Did they cause a craving like response? Like, what are you seeing in the history?
Yeah, I would say in general, as you were even saying before, ketamine is rarely someone's drug of choice. You know,
It was never mine. It was always, golly, man, we gotta get out of here. Let's try something. But it was not fun at all. But I do know people who did abuse it. I do. But
yeah,
anyhow, go ahead. I didn't mean to cut you off.
yeah, no worries. So you know, ketamine, hallucinogens are another category of substances that are rarely someone's drug of choice, but it definitely can happen. And so that's not to say that certain people may have cravings being triggered by ketamine, or maybe it could be a spark that sets off a relapse. I never say never. And I think that's a sign of respect for the medication too, to know that like there's some non-zero possibility that, like you were saying, your friend kind of had a relapse set off by it. So it's rare, incredibly rare. I maybe heard of one person in the 6 years that we've been doing it that developed an issue, and at that point we stop and shift gears and get them into treatment. And like I said, there's plenty of other treatments that are out there too. But on the whole, many more people have benefited than actually been harmed. And so when we weigh decisions in medicine, we always weigh the pros and cons of a certain treatment decision versus the pros and cons of not proceeding down that way. And so we'll only go down that ketamine route if it seems like the expected benefit outweighs the expected risk in a person.
How do you know? Do you just believe everyone, like, with all the stuff that they tell you, or is there a way to discern, like, okay, this guy, just because we are so sneaky, and to get an Adderall prescription, I know exactly what to say, like stuff like that.
Right.
And so do you have like complete and total faith that all of these patients are being completely honest with you and saying like, yeah, no, I'm totally fine, no cravings, all that? Or like, what does that look like from your perspective?
Yeah, and that really speaks to one of the reasons that I started our ketamine therapy program in the first place, is that I just kept on seeing these examples of other ketamine clinics in our Los Angeles community that people were showing up, getting ketamine treatments. And I, as a psychiatrist, was only finding out after the patient came back to my office and was telling me about this treatment that they had. And I'm here wondering, like, this person has severe depression. Why not even reach out to their psychiatrist? So I just knew that the way that ketamine treatment was being practiced, especially from 2014 to 2019, really wasn't the way that it should be done. And I felt, as a psychiatrist, also someone who specializes in addiction, that it is important to reach out to other people in a person's life. That could include family members, that certainly includes other healthcare professionals. Like, at a minimum, we do reach out to their other doctors, their therapists. Very often they come in working with a therapist. And I always want to have the green light of all of the quote stakeholders in a person's sobriety, and have everyone understand, what the decision is that we're weighing here. And if they have any questions or objections, voice them now before we kind of proceed down that path. So, to me, that's a sign of a, good faithful investigation if, for a person's appropriateness for ketamine treatment.
Do you have a lot of patients like given consent for you to like talk to their families and all that kind of stuff? Or do you ever run into people that are like, no, like, no one knows I'm doing this?
Yeah, the ones that do give consent, I mean, the one type of patient presentation in our office is the family's reaching out to us first. So if the family had made the appointment, and there's they're also like paying for their treatment, let's say, I know that there's family involved, I will then ask for that person's consent to talk to them. And if they're an adult, they have the right to give it or not. But if they don't give it, then I also have the right to say, I'm not comfortable providing that treatment. Maybe we can try this sort of standard treatment. But for me to give this sort of treatment, and honestly, it goes, like I said, to controlled substances being used for other conditions, including Suboxone for opioid dependence. David was saying, people nodding off on Suboxone. I mean, that's, to me, a bad outcome that should never be. Or the other stimulants for ADHD and other meds for sleep and all.
Excuse me. So what do you do with somebody like me who's come in? I've had sobriety. I've been doing the deal, but I'm wrestling with some issues that are lingering. They're not going away, whether it's depression, anxiety, maybe some bad sleep. And you say, look, I really want to put you on these 2 medications to help you with your mood swings and to get you some sleep. And I think that, once a month treatment like this would help. The ketamine would probably help. And I'm just like, no, I don't want to do it. I don't want to be on meds. I don't want to be on meds. What other treatments, modalities, whatever it is, are you using to help somebody like me?
Therapy is a big one. There's a lot of research out there, certainly for mild to moderate mental health issues, that therapy is just as good as medications. The saying in psychiatry is medications work, therapy works, but it's actually the combination of the two that yields the most potent result. So, I'm a huge fan of therapy. I think of therapy equivalent for your psychological or spiritual self, like what exercise is to your physical body, and I
For
think
some of our listeners, though, that have not been to therapy, they might have just been to a bunch of 12-step meetings. And just like exercise, there's a lot of different types of exercises. Tell us some of what are the different things that are non-medicine based therapies that when you talk about therapy, whether it's talk therapy, whether it's CBT, whether it's actual EMDR, but tell us our listeners a little bit about what those might look like and what those do.
Yeah. Therapy usually consists of a once a week meeting with a licensed healthcare professional, which could be a psychiatrist. It could also be a MFT, marriage and family therapist, LCSW, licensed clinical social worker. So many different types of healthcare professionals practice psychotherapy. So they come into the office, or actually since the pandemic, most often it's via Zoom. There's a 1 hour meeting where a person talks about their issues. There's specific target symptoms that are come up with that are going to be targets for the treatment. So it could be depression, it could be insomnia, anxiety. Those tend to be the big 3 that people are struggling with. And then
what were the big 3 you say? Insomnia?
Depression, anxiety, insomnia.
Okay, so that's kind of the trinity, the whole of the problem trifecta right there. And I'll tell you, in my sobriety, that's the things that I've wrestled with the most: anxiety, depression, and then just bad sleep. Go through long periods and not be able, and then once that goes off the rails, man, I'm toast, dude. I'm done.
Right.
So we see that over and over again. So we're doing different forms of talk therapy that can sometimes address some of those things.
Yeah. So we look at the consequences that those things have in a person's life. How do they hold a person back? And the goal of treatment in general is to remove those as obstacles to their full functioning. Psychiatry, mental health treatment in general is about improving a person's functioning and making sure that it's not impaired by their depression, anxiety, or insomnia. They may have appropriate feelings of sadness or, some amount of difficulty sleeping, but honestly, if it takes less than half an hour to fall asleep, we don't call it insomnia. We say that's normal. Or if a person has sadness or grief after a loss, we also don't pathologize or label that as a problem. We allow the space for people to have normal human emotions. So I think that also needs to be recognized, because one of people's main concerns is, oh, am I going to be numb? Am I going to, or they might even say, like, I don't want to feel anything, and so that's not the goal of treatment, and it's important to clarify that with the person before proceeding to.
Yeah, what do they say in the program? They say the good news is you're going to get your feelings back. The bad news is you're going to get all your feelings back.
Yeah.
Like it can be a lot sometimes. Be a whole
Yeah.
lot.
And so therapy could be about coping with those feelings. You know, maybe they didn't have a great upbringing with parents that were emotionally attuned, and even asking them about, like, you know, I see that you're sad. Tell me what's wrong, Johnny. You know, emotional attunement is arguably one of the most important roles of a parent to a child, you know, and so if they're not shown how to identify their feelings, evaluate what those feelings should be advising them to do or not do, and then figuring out how to metabolize those feelings, how to process them, how to turn the appropriate things into action. You know, yeah, like the serenity prayer is honestly something I use even for the treatment of mental health issues, to know the difference between the things that you can do something about and that you can't. If it's things you can't do something about, then working on a sense of peace and accepting, or escaping a bad situation could be the result, the resultant advice. Or if a person is able to do something, to have the courage to be able to implement those changes in their lives.
Wait, can you talk a little more about the emotional attunement and parenting? Like, what's a real life example of that? I need all the tips I can get.
Yeah, you know, a kid, kid lost their lunchbox, and it was their favorite lunchbox, and you know they're sad. You know, if the parent says, like, stop crying, it doesn't matter. You know, the message that they're going to get from that is, I can't feel my feelings. That thing doesn't matter to my parent, even though it matters to me. I must not matter to my parent, and I don't amount to much, you know, like, so that we would say are like kind of logical fallacies, the downstream effects of a parent that is telling them that, you know, stop your crying, it doesn't matter.
So what should they say instead?
Oh
Asking
my
for
gosh. Yeah. Like, oh my gosh, I'm so sorry. That was your favorite lunchbox. I know that it was. It's so sad. Let's figure out what we can do about it. Maybe we can go back to your school, retrace your steps, maybe call the school. Is there a lost and found? You know, that sort of thing. If it's gone forever, you know, maybe we can figure out another solution, either getting you another one or brown bagging it for a while. I mean, you know, just
kind of diving into it with them.
yeah, and showing them that negative emotions are actually the first step of a path that could lead to resolving a problem, and their emotions do matter, and they do matter. Their experience of it matters.
I like that.
Yeah.
That's cool.
Yeah, I know I'm about to ask an Eskimo who needs ice, but from what you see working in the addiction field, and you said you've been to a bunch of meetings, I'm sure you're as deep as your education went. You've been in a lot of like 12-step style meetings. You've been around a lot of people that are in recovery, but based on what you see, people who are just in recovery in general, how many of them do you think, like on a scale, probably need to be working with a therapist on an ongoing, kind of as a part of, just like meetings for me are not of this month thing or next month, they're going to be a continuation of my life just because that's where it's gotten. How many people in recovery do you think probably need to be working with a therapist as an ongoing, just a piece of their mental and emotional well-being?
Yeah, I mean, I'd say at some point in their lives, everyone needs therapy. I think, you know, they if they have the recovery issues that you've described, like, they've met criteria, they deserve to have had some therapy at some point in their lives. You know, many people will do therapy for a while, 6 to 12 months, and then kind of take a break for a while because things are going okay, and then go back into therapy periodically, you know, kind of on and off throughout the years. So, you know, at any one point, you know, maybe only 10% of people need, like, quote, ongoing therapy. But even just having that relationship with a therapist is really healing. It can be as in like a security blanket in a way. Like if the S hits the fan, I can reach out to my therapist. I have a person that's an unbiased professional that has been trained, that can listen to me. So it's not just a friend or someone that it might have other roles in my life that might complicate the type of advice they give me or the insights they give me, because we want someone to be an unbiased professional, and that's one of the criteria of a therapist also.
Yeah.
So yeah.
Yeah, and I've heard it said, I'm not sure that I've ever done it, but the time to find therapy is sometimes when the crisis isn't happening, when it's not going on. So you can just kind of build a relationship, build a communication, and start working on things when it's not life or death. Cause I know, like, me and my wife have a fight and we're like, we need to go see a therapist. And we look for somebody for a week and then we kind of forget about it. And then, 6 months goes by and the thing pops up again, whatever it was. I didn't pick the lid up or don't take the trash out right or whatever it is. And it's like, we need to find a therapist. And then we look for 2 or 3 weeks and we don't get one. And so it's kind of been like, we should probably just do this when things are good, So like, but then it's like, no, we're going to go shopping. We're going on vacation when things are good. We just don't ever really do it. But I know, but people in addiction, people in recovery, things are going to pop up. Like it's going to happen. And I've been seeing the same therapist for almost a year and a half. And I got to tell you, we're not really working on anything. We're not working on the thing that brought me in to the room right now. Like the thing that brought me in the room has pretty much been talked about. We've worked through it. I've worked through it. I've learned from it. But now I'm pretty much doing it to maintain the communication and to have him there if something does pop up. And it is nice to have somebody where just ongoing dialogue that's just kind of happening. So I really appreciate just therapists in general that are willing to go on that long haul with people instead of the one and done. Here it is. We're going to slap a fix on you, because I really think that most of this stuff, we hear it said over and over again. The opposite of addiction is connection. The opposite of addiction is not abstinence. The opposite of addiction is like, I have a real relationship with people that I can talk to. I can work through my emotions, whether it's because I lost my lunchbox or it's because I went through a bad breakup or whatever it is. People are listening to me and I'm talking. And I think that's another level of our kind of reticence to some of these medications, is that what we're looking for is not a chemical connection, although they might be helpful. What we really honestly, really, really yearn for is that personal connection with another human being. And so like, I'll be very much inclined to go sit down with a therapist and talk about stuff, even if nothing's going on, to deepen that relationship. It's really a hard sell for me to think about other stuff. However, other stuff is medicines. However, I do know friends that I'm like, man, they might benefit from this, because I've seen them go on for years and years and they've just never really made the breakthrough, whatever it is. They go to meetings, they get a sponsor, they try, and then the thing happens over and over again. So I got to tell you, whatever it is that you're doing, whether it's the long-term talk therapy or whether it's some medically assisted stuff, I appreciate you doing what you do and doing what they said, Dr. Silkworth was doing. He was sitting on the firing lines. He said, come sit with us for a little while and you will not see why we're so sympathetic about our work. I mean, like it's real work. Like you're seeing the broken families, the despairing wives, you're seeing it every day and you're trying to be helpful. So no matter what, hard questions we might throw your way or whatever headwinds you might have doing what you do, I got to tell you right now, I appreciate your energy, and I mean, you can tell you're doing it because you believe in it and you want to help people out. So no matter what my biases are, thank you for doing the work that you're doing, and please continue to do it.
Yeah, thank you. And thank you for your show and spreading the word too. I really appreciate that as well.
So, where can people find you, Dr. Hrymoc? And do you have any advice for anyone out there that is struggling with anxiety, depression, substance use? What you got for them?
Yeah, our website is mentalhealthctr.com, the abbreviation for center. The advice that I would give is to reach out to a mental health professional. There is no shame in that. Everyone has issues. Honestly, I believe it's part of the human condition to have stresses and problems in your life. and even just getting a checkup is a good idea. That even reaching out doesn't mean that you're committing to take a medication. It really just means you're getting an assessment by an unbiased professional who is mainly looking out for your interest to help remove unnecessary self-limitations or limitations imposed by depression, anxiety, etc. in a person's life.
Before we go, sorry, we're supposed to close out, but I have one more question.
Sure.
Do you ever, as like a medical professional, does the aspect of like spirituality ever come into play as like a solution? I just know, like personally, as a Christian, like the more aligned my life is with God and his will for my life, and the more I'm communicating with Jesus in my life, the not necessarily the better the circumstances get, but the better like my depression is, the better my anxiety is, you know, all that kind of stuff. Is the medical community, did they what's your thoughts on that? Because I
Do they recognize it
Yeah.
as something that's beneficial in a person's mental health? I hear you asking, and I'd say yes. The answer is yes. I would consider it a support to a person that maybe a person without religion doesn't have. It doesn't mean that every single person needs that support, or it's my job to instill that type of spiritual support in a person. But if I see evidence of it and it's something that's helping them along their path to healing and recovery, then I'll encourage it.
Yeah.
Yeah.
All right. Well, thank you so much. And thanks for letting me ask all the questions. I always have a bunch of questions, and thanks for allowing me to be honest with my feelings about it and just being open to answering those. And like David said, we do appreciate, you know, what you do, and we know that you are going to help a lot of people out there.
Of course. Yeah. Thank you so much for all your great questions. I really enjoyed talking to.
Yeah, thank you for giving us the time, doctor. It was really I know you got a lot of it. You could be billing for this. I'm sure you could be billing somebody for this, and you're coming and donating your time to get this message out. Anything else you want to share with our listeners before we go?
You know, I hope that everyone is able to be everything that they can be, that they are not held back by unnecessary depression, anxiety, other issues, and that they can enjoy full, healthy lives, which include full, healthy relationships and a career or path of study, you know, something that gives people meaning in their lives and reasons to wake up and look forward to living every day.
There you go. I love it. Thank you so much.
All right. Thanks, guys.
Yeah.